Alternative medicine for depression. That's what I'm going to talk about today. I'm Dr. Tracy Marks, a psychiatrist, and on this channel, I talk about mental health education and self-improvement. I publish videos every week, so if you don't want to miss one, press the subscribe button. We have many prescription options to treat depression today, but there are people who don't believe in taking prescription medications.
I ain't taking nobody's medication.
But they may be okay with taking something over the counter. Now, keep in mind that just because it's derived naturally does not mean that it's not a drug. Really, anything that has a chemical effect on your body is a drug. Nevertheless, here are 8 drugs that are known to be used for depression. Number 1, 5-HTP. 5-HTP is a precursor to serotonin. This means that it's part of the chemical pathway to make serotonin. So it's serotonin-like. There's been about 30 clinical trials showing some promising results with 5-HTP, but here's the downside. It has a really short half-life, which requires you to take it 3 to 4 times a day. So if you've never taken a medication before, it's hard enough to remember to take something once a day, much less 3 or 4 times a day. The common side effect is wicked nausea and maybe even vomiting. Number 2, inositol. Inositol is abundant in the brain, and chemically it's a sugar alcohol, and it's a building block for other chemicals in the body. We don't really know exactly how it helps depression, and there haven't been a lot of studies showing effectiveness. In the few studies that I've seen, though, it was used as an add-on treatment. So you would take it in addition to something that you were already taking for depression. The main side effects of it are gas and mania. Number 3, L-methylfolate. Folate is vitamin B9, which is an essential vitamin of the body. And usually when you hear the term or the word essential, it just means that your body doesn't make it. And the only way you can get it is through your diet or supplements. And while I'm talking about this, folate is the naturally occurring nutrient that you get from green leafy vegetables, egg yolks, etc. Folic acid is a synthetic dietary supplement. Neither folate nor folic acid are biologically active in the body. Your body has to do something to it first. So once your body metabolizes either the folate or folic acid, the active form is called L-methylfolate. So that's where L-methylfolate comes from. L-methylfolate is a building block for serotonin, norepinephrine, and dopamine, and these are all chemicals involved in mood. Studies have shown that people with low folate levels in the body tend to have a more severe depression, and they don't respond as well to antidepressants. So in practice, L-methylfolate is best used also as an add-on treatment to your antidepressant. I don't really think it will do much if you just use it alone. You can get a prescription for L-methylfolate from your doctor, and it's technically considered a biological food, but it still requires a prescription. And many insurances are now paying for it, but if yours doesn't, it can cost upwards of $100. So folic acid can be a good option and cheaper substitute for that. It's just that your body will have to process it into the L-methylfolate. Next is saffron stigna. Yes, this is the same yellow spice that's used to season rice. There's been a limited number of studies, but enough to show some positive results. The recommended dose is 15 milligrams twice a day, so here again you have the inconvenience of needing to take it twice. When a medication is recommended for more than once a day, usually it's not as effective, or maybe not even effective at all if you only take it once a day. So if you are going to take something like this where it's required multiple times a day, you really do need to take it multiple times a day to get the desired effect. Saffron is expensive, and you should definitely consult your doctor if you're considering taking it and you're on blood thinning medications. Next is SAMe. SAMe stands for S-adenosylmethionine. You never want to need to say that. It enhances serotonin and norepinephrine. The studies show effectiveness in treating mild to moderate depression. However, many of the studies use small sample sizes and different forms of the drug, like the injectable form. Like, who's going to actually do that? So that's kind of the downside of the studies. But the recommended dose is 200 to 800 milligrams twice a day. As far as side effects, you can get some nausea with SAM-E, and you should also avoid it if you have bipolar disorder, as it can worsen your mania. St. John's wort. St. John's wort is an herb, and it comes the closest to the antidepressants as far as effectiveness. It's been shown to help mild depression as a single agent. So all of these others that I've talked about, well, maybe not SAM-E. SAM-E has been used alone as well. The others, you kind of need to take it with something. St. John's wort is another one that has been studied as a standalone agent. It's not as good though for moderate to severe depression. The recommended dose is 300 milligrams 3 times a day. And it can interfere with the metabolism of other medications. So if you're taking another prescription medication, you need to tell your doctor about the St. John's wort, so he or she can determine whether or not it's going to interfere with any of your other medications. Lastly, there's omega-3 fatty acids and vitamin D. And omega-3 fatty acids fight inflammation in the body. And depression is thought to have an inflammatory component to it. You can check out a video I did on omega-3 fatty acids if you want to know more about omega-3s. For depression, the recommended dose is 1 to 2 grams of EPA plus DHA. And it's better actually if there's more EPA than DHA. It won't work alone, and it's meant to take as a supplement. Most of the vitamin D in your body is made in your skin from sun exposure. You can get some from your diet, but it's mostly from sun exposure. Many people are vitamin D deficient and don't know it. Vitamin D supplementation has been shown to improve depression in people on medication and who are vitamin D deficient. It was not that helpful for depressed people who were not already deficient. So just like omega-3, vitamin D is considered an add-on therapy. The recommended dose is 1,000 to 5,000 international units. One important thing about vitamin D though, vitamin D is a fat-soluble vitamin, so it can accumulate in your body. So you don't want to take too much of it thinking that if 1,000 or 5,000 helps, then maybe 10,000 is even better. More is not better unless you have a deficiency, and the only way to find that out is to get tested. Thanks for watching this today. Check out some of my other videos. Until next time.